There we go. So yeah, Christine, if you wanted to get started, I will hand over to you.
I think that's me, actually, Amanda.
Oh, starting with Steph. Perfect.
It's all right. I have a very, very small speaking role today. So I'd like to welcome everyone to, on behalf of our members and partners, to the Kawartha Lakes Haliburton Ontario Health Team Lunch and Learn, episode number 2. We're very pleased to be offering this spotlight series highlighting work that's being done across our Ontario Health Team members and partners. And we hope you enjoy it. Can you advance the slide, please? Okay, so the introduction to OHT. I guess I won't run through the OHT. I won't run through the agenda, but we'll go back and Christine can do that. I'll do the introduction to OHT and then pass it right over to her. Okay, so as an OHT, we are a collaboration of service providers, health and social service providers working across the city of Kawartha Lakes and Haliburton County geographies, working to advance integrated care through an equity lens and all of the key enablers of an integrated care, a system of integrated care. Early on in our development, we were asked by the Ministry of Health and Ontario Health to identify priority population for our first year of work, which for us, our governance team identified older adults living in community as the priority population for our first year of work. And as such, we implemented some programming to support older adults, particularly during the virtual pivot of COVID. And Christine and team will tell you a great deal more about this as we advance the presentation today. So I am pleased now to pass the podium, so the virtual podium, over to Christine to stick handle.
Thank you, Stephanie. Amanda, can we just jump back one slide and then we'll jump forward 2 slides? So thank you, Stephanie, and thanks for everybody who took the time to join us today. The topic is wellness connections and how it links to social prescribing, but we're also going to talk about frailty. Sabine is going to go over that as it does relate directly to the program. And, you know, we've seen some really great impact that this program has for the clients who are enrolled in the program. And we hope by the end of the session that you find it valuable too. So my name is Christine. I'm a project coordinator with the Kawartha Lakes Haliburton Ontario Health Team, and I'm also joined by Sabine Esson from the Seniors Care Network and Faith Davis, who is the Enhanced Care Coordinator at Haliburton Health Sciences, Haliburton Highlands Health Sciences, excuse me. So I'm going to pass the slides over to Sabine to talk about frailty. So Amanda will have to jump forward 2 slides. There we go. Over to you, Sabine.
And thank you so much, Christine. As she mentioned, my name is Sabine Hassan. I'm the Director of Quality and Planning at Seniors Care Network. And before Christine and Faith take a deep dive into the Wellness Connections program and the impact that it is creating, I thought it would be worthwhile to give a quick refresher on the concept of frailty for those who may not be as familiar with it. So the Canadian Frailty Network defines frailty as a state of increased vulnerability with reduced physical reserve and loss of function across multiple body systems. It can be a predictor of reduced quality of life, mortality, and may also increase the risk of hospital or long-term care admissions. As depicted in the figure on the right, a variety of physical, cognitive, mental, and social factors may contribute to frailty. Considered this way, an older adult may simultaneously demonstrate some or all of the following. They may present with a change or reduction in function from a relatively minor physical illness or a change in their cognition, which basically means changes in memory or thinking. They may also present with poor psychological well-being that can impact their mood and overall mental health, or they may have access to limited social support, such as housing or food insecurity. However, it is important to note that frailty is not an inevitable consequence of aging, and therefore it can be prevented and mitigated. And this is essentially the crux of the Wellness Connections program. Next slide, please. Therefore, the Canadian Frailty Network recommends building resilience in the older individuals or those who may be at the risk of frailty through the Avoid Frailty framework. So as depicted in this screenshot from the Canadian Frailty Network's website, it is a simple yet powerful framework that recommends physical activity, vaccinations, optimization of medications, social interactions, and adequate diet and nutrition. By adopting these healthy habits and preventative strategies, frailty can be avoided altogether, or its progression can be halted. Next slide, please. So I would like to draw your attention to the sections that are highlighted in red in this rather busy driver diagram. What I was trying to speak to is that promoting self-management habits and early and proactive identification through frailty screening can have system-level impacts. They both contribute to optimizing function and quality of life that in turn contribute towards reducing ALC rates, that is, long-term hospital admissions because the demands cannot be met in the community, and even LTC admissions. So why avoid frailty? Because doing these upstream work can actually have impact on system-level planning, and it can also offset system-level pressures. So now I'm going to hand it over to Christine and Faith to speak about the Wellness Connections program. So Amanda, please move on to the next slide.
Thanks, Sabine. Amanda, you can move ahead one more slide, please. So the Wellness Connections program, it is based on the Canadian Frailty Network's Avoid Frailty framework and is also an upstream ALC avoidance strategy. The program was originally developed in response to COVID-19 to help clients connect to virtual care, maintain social connections, as well as increase and support access to technology. And there was a great initial response from participants. The program is designed for people over the age of 65, although if you have access to the internet, you can register yourself for the online platform. The majority of clients who are currently enrolled in the program are actually over the age of 75. The objectives of the program are to promote learning about healthy changes and choices to age well through structured modules or courses available on our online learning platform, which I'll review in just a couple of slides, and also to connect people to local service providers who offer supportive and preventative programs for health and well-being. Next slide, please. And so there's a lot of features within the Wellness Connections program, but sort of the main components is the online learning platform, the connection to supportive and preventative programs, and an important piece as well is that we have an iPad lending program so that everybody who wants to and is interested in the program has access to it. So the slide here just shows a screenshot of the online learning platform. It's designed to be really user-friendly and engaging. It provides courses or modules that correspond with each of the Avoid Frailty domains. Within each of the courses, there are short videos and easy to read articles, as well as direct links to local in-person, as well as virtual programs related to each of those topics. So for example, in the activity course, you'll find that there's direct links to local walking programs, exercise programs, or programs available at the local rec center. Next slide, please. Also within the online platform, clients can take a self-assessment. They can develop a wellness plan that's based on SMART goals. They can keep track of their progress, earn certificates, use a chat feature to ask questions and share information. And we also have a feedback function where users can leave ratings and comments to help us improve the site and its contents. The program is designed to be self-paced. People can move freely throughout the platform. They can complete one module, all of the modules, it's really up to them. And it also allows us to track data. So we can track things like the number of registered users on the site, the number of self-assessments completed, the number of wellness plans developed, and much, much more. Next slide, please. And so referrals to the program are really easy. People can refer through the KLH-OHT website via our e-referral platform. They can call the number that's available on our website, It's also available on all of our marketing materials as well. And if there's any primary care providers joining us today, referrals are really seamless through the Ocean integration. People can refer themselves. You can refer a family, a friend, a neighbor. If you're a primary care provider, you can refer your patients as well, with their permission, of course. And so the intake process starts with a phone call to the client to provide an overview and benefit of the program and to offer to do a home visit. If a client accepts a home visit, which most do, the program coordinator spends time getting to know the client, talking about, what is their current situation? Do they have any concerns or needs? As well, we spend time talking about what are their strengths, what are their interests, and what is their motivation for change. The program really isn't designed to tell people what they should do. It's designed to show people what they can do and how they can have support with that as well. As of February this year, during the home visit, we use a frailty screening tool. We also call this a wellness assessment. So we use that term interchangeably because frailty can sometimes have a negative connotation to it. And we want to make sure people are comfortable using the tool. Next slide, please. So this slide shows what the tool looks like. It's called the Pictorial Fit Frail Scale. It's a really simple visual tool that's completed by the client with help if needed. Once it's completed, the coordinator scores and adds the entries, and the overall score provides insight into the client's wellness status. So, for example, whether they show at a risk of frailty, have a presence of frailty, or no frailty. Next slide, please. So using the overall score of the frailty screen or the wellness assessment, the coordinator follows the Ontario Collaborative of Aging Well decision tree to respond appropriately. So it could be identifying the learning needs of the client, communicating the frailty status of the client with their primary care provider where appropriate. If a client has a score of severe frailty, with the client's permission, the coordinator would initiate a referral to specialized geriatric services such as GAIN, and then also connect people to those preventative and supportive programs. Next slide, please. So during the program, there are follow-ups and check-ins available. It's not just a one and done. Here's a program, here's the learning modules, off you go. We really want to make sure that people feel supported during this program. And so some folks receive in-home visits. Some people get a phone call just to see how they're going and how it's going and to check in. And some clients actually do a touch base via Zoom. Once clients are discharged, really once their needs have been met, they're comfortable with their wellness plan or the connection to services, they're confident moving forward without the support of the program coordinator. And the average length of stay in the program, I would say, is about 6 months. Once clients are discharged or just before discharge, we ask that they complete an experience survey, and this can be done through email or it can be a paper-based survey as well. Next slide, please. And so as of August this year, we've received 58 referrals to the program, completed 18 frailty screenings or wellness assessments, and have been able to connect clients with over 35 community programs and services, most notably walking programs and the Good Food Box program provided by Community Care in the City of Kawartha Lakes. Of the client experience surveys that we've received so far, 100% report that the program helped them with improving their knowledge regarding healthy aging and choices. 100% reported that the program and services were beneficial to them and rated their overall experience in the program as a 9 out of 10. And so we've seen some really great results so far and have had a really positive impact on the folks who are enrolled in the program. Next slide, please. And so we've seen a lot of successes with people, but I wanted to share this one in particular. A person self-referred themselves to the Wellness Connections program. They called the phone number that they found on a brochure. The coordinator completed a home visit to get to know the client, talk about, what are their wellness goals, what's going well, what can we help with, and what kind of support do they need. And this person in particular identified needing support with anxiety that had recently come up in their life, later in life, and has having an impact on their quality of life. And so the coordinator scheduled bi-weekly home visits. The client was connected to Bounce Back Ontario and Anxiety Canada online programs. The client registered for both online programs and uses structured cognitive behavioral therapy virtually. And as a result of that, they're able to recognize major sources of their anxiety on their own and develop a plan to address and improve with ongoing support from the coordinator and the program. Next slide. And recently the program has just expanded to Haliburton Highlands. So I'm going to pass it over to Faith Davis, who is the Enhanced Care Coordinator at KLH-OHT, and she's going to talk about how they see this program fitting into Haliburton and surrounding areas. Over to you, Faith.
Thanks, Christine. Hi, everyone. So as we are set up to go forward as of December 1st for the hard launch, but we are already promoting materials in our programs and our information packages. Any referrals can be easily done over the phone, possible for a home visit, and there is a web form available on our website as well, KLH-OHT.ca. We have a lending program, so we have 8 tablets available with a three-month lending period. Of course, that can be relent out as well. I'm really excited to see how this program will help our clients and our community take a driver's seat and to be proactive in their aging well process. I think it'll give them tools and extra supports.
Great. Thank you, Faith. We look forward to hearing about all of your success stories.
Thank you.
Next slide, please, Amanda. Thank you. And so we've talked about frailty and how it relates to the Wellness Connections program, but the Wellness Connections program also fits well into a social prescribing model. And for people who are not, you can go back one slide, Amanda. Thanks. If you're not familiar with the term social prescribing is a means of connecting patients to a range of non-clinical services in their community to improve their health and well-being. It builds on evidence that addressing social determinants of health is key to improving health outcomes. It is a program that is co-designed with the patient based on their needs, interests, strengths, and abilities, and improves outcomes for people by giving them more choice and control over their lives and an improved sense of belonging when people get involved in their communities. Next slide, please. And so you can see on the screen here, this is an image that depicts an example of a social prescribing model. And so the Wellness Connection program fits well into this. It provides a formal referral pathway. It provides an intake through the wellness assessment or frailty screen, provides individualized support and follow-up. The program coordinator acts as sort of a navigator or a link worker to provide the time to really actively listen to the person, co-design a plan together based on strengths and interests and need via the wellness plan on the online learning platform, as well as provide supported transitions to those programs of support, and also allows us to track outcomes, which is really important. And we do that through the reports we're able to run on the online learning platform. We can find data through our e-referral platform, and of course, our program evaluation. Next slide, please. You can go ahead one more, Amanda. Thank you. And so that was a quick overview, but some of the things we want you to take away today is that this program is really person-centered, it's evidence-based, and it's co-designed. Referrals are very easy to make. We prefer that you make them through our e-referral platform on our website. It's not purely virtual. There is in-person support and check-ins. We do have iPads to make sure everybody has access to the program. Our client experience surveys indicate that the online learning platform and those connections with programs and services are valued. They're open to completing the wellness assessment or the frailty screening. And, our ask is just refer to the program, refer yourself, refer your clients, refer your family, friends, or neighbor, anybody who you think could benefit from this program. Next slide, please. We do have time for questions. We have lots of time, actually. But before we do that, I'm going to pass it over to Stephanie to talk about our next Lunch and Learn session.
Gosh, I'm just messing everything up on you today. I'm ahead of the game and now I'm behind the game. So I wanted to just invite anybody who's interested for this very convenient format of a 45-minute quick spin through some OHT level interventions, one of which Christine's actually made mention to, which is our navigation platform that's part of our website, which is both a public and provider facing platform. We are in the process of doing a formal launch. We feel it's robust enough to do that now, which really surfaces a lot of the programs and services across our OHT region in an accessible way, with many agencies receiving self-refer or receiving e-referrals through the platform. And it's also integrated with the Ocean e-referral platform through primary care providers' offices. So we'd like to talk a little bit about how to optimize the use of this as a caregiver, either a formal service provider or a member of the public, for yourself, for your loved one, etc. So we want to broaden the awareness of the public and providers around our navigation solution. And that will be November 29th, 12:15 to 1 o'clock. We hope to see you there.
Thanks.
And now we'll pass it back for questions.
Thank you. Any questions?
If you have any questions, you can feel free to come off mute or raise your hand or put it in the chat. No, I see Judith, you have your hand up. And you might be on mute as well.
I think you, there we go. Yes, I'm really happy about your navigation program because I've come into a point with my healthcare needs that there's so many people that I have to deal with that I can't keep track of it all. And my doctor's group doesn't really keep track of it. So, I get something and I think, well, what do I do with this? So can an individual sign up for it and you're paired with somebody who will kind of be your shadow and all of this information activity?
At this juncture, Judith, not specifically in terms of like an at the elbow support person to assist in multiple. It's really multiple navigation, which is what I hear you speaking to. Definitely a need and a next step. I think there's a few pieces. The platform could be used to identify a service provider in the system that might be able to help you organize that your care plan a little more easily. But at this point, it's really a wayfinding tool to ensure that you're attached to the best service for your needs and program for your needs.
Okay, thank you, Stephanie.
Thanks for the question, Judith. Any other questions, comments, any questions around how to make referrals?
Shannon,
a
are you
question.
trying to go? There you go.
Okay, great. Oh shoot, I forgot my question. No, are there any challenges with internet for the folks that are getting the tablets? Is that something has been a barrier? Are there spots that people could go to if they didn't have great internet service?
Yeah, that's a good question, Sharon. Thank you. And we do have the iPads that we can loan out, but we can also provide temporary access to internet through Wi-Fi and MiFi devices. So people that don't have access to internet or really poor internet based on where they live, we can help them with that as well. So thanks for that question.
Great. And a second part, so I am aware of this program and I'm a little embarrassed to say that I wasn't promoting it as much as I could have been. Just today we had a volunteer connection and we were able to chat about it. And so I think there's an opportunity for us with grief and bereavement for people that have maybe gone through some of our programs and have are in a better place about through their grief journey, that this would be a great next step for them.
Yeah, absolutely. So I'm happy to carry on the conversation if you'd like some more information, or any of your staff who are interested as well.
Great, thanks.
Thank you.
I don't want to speak on behalf of Faith and Christine, but based on the results of our evaluation, if we do get feedback from clients that, you know, your virtual module is not as effective, etc., but we can also look at creative, collective sessions with clients too. There are, other ways of looking at these things as well. Maybe we can have like a show party of sorts where maybe multiple clients can sit and watch certain modules together if that is required or wanted.
I think that's a good idea.
Great suggestion. Thanks, Sabine.
Right, and Christine and team, we've had a question come through, just asking, is there a catalog of social services that are available? I don't know if Christine or Steph, if you wanted to answer that one.
Yeah, go ahead, Stephanie. I'm not sure if the question is related directly to the online learning platform, if there is a list of social services.
The question was from Carol. I don't know if you wanted to come off mute and.
Yeah, I'm happy to ask. I was just wondering, like your social programming that you're redirecting, so that you're prescribing. I'm just wondering how you built that catalog of resources.
Oh, I see. Yeah, so we did an asset map of all of the services available in the city of Kawartha Lakes, and within the online learning platform, the services that are listed are related directly to those avoid domains. So we have services related to activity, optimizing medication, social interaction, diet, nutrition, and we've also included sleep and falls in that as well. Does that answer your question, Carol?
Yes, thank you so much.
And if I can add to that, we have social prescribing is an ongoing work in progress for the OHT as a means of identifying more informal community assets that we have, programs, service clubs, informal groups that may be welcoming to new members, like informal walking groups in Fenland Falls, for example, those kinds of things. And we are seeking ways to further our reach, so to speak, in terms of the more micro, like, so if you live in Minden, what's really locally available in Minden that might not be a formal program or service that you could connect to, but that is open for anybody to participate in. So we'll have some very creative ways, I think, in the very near future of engaging our smaller communities in terms of identifying what we should have in that catalog of offerings, so to speak, Carol.
Okay, and I don't see any more questions coming through, and it looks like we're 2 minutes early. I've just put up on the last slide here our website if you want to go have a look at that. And I put our email address up there too, info@klhoht.ca. If you have any ideas for any future lunch and learns that you would like to see or any feedback from this session, you can contact me there. We will send out an evaluation form as well, though. And just make sure that you're following us on the social media pages too. The future lunch and learns that we do put out, we'll advertise there as well. But that was it for me. Christine, do you have any other closing remarks?
Just a big thank you for taking the time to join us today and learn about the Wellness Connections program. And like Amanda said, visit our website, call the number if you have any questions. I'm happy to have a conversation with you to talk about referrals or anybody you think could benefit from the program, or presenting to other groups. If you think you have a group in mind you think would benefit from this presentation, we'd be happy to do that as well.
All right. Thanks, Christine, and thanks everyone for joining today.
Thanks, everybody. Have a great day.
Take care.
Thank you.